Good morning, 6:06. Well, a little rainy out there this morning where I am. I don't know how it is where you are. Quite possibly you haven't peeked out the window yet. Yeah, you're not going to see much because it's awfully dark. Well, the next chapter that we're going to be dealing with here is sorry if I slurped too much that time. Chapter 16, Paretic and supranuclear strabismus. It's right there in the AOC syllabus, wedged, I do believe, wedged in between chapters 15 and chapter 17. Are we ready? Paretic and supranuclear strabismus. Well, there's a lot of meat to cover here, a lot of territory to cover. But as a preamble, a pre anything is before the amble. A preamble to that is to say that um, strabismus can be seen in basically two flavors, two varieties, two forms. This is one uh, simplified form of discussing strabismus, but uh, it can be seen, measured, looked at, talked about from a signs and symptoms standpoint, a history standpoint, a age of onset standpoint. But one simple way of discussing it is in the form of either a comitant deviation or an incomitant deviation. Comitant deviations being ones where they are relatively the same in gaze positions as they are in primary position. An incomitant deviation is a deviation that uh, varies significantly, varies enough that it rises to the level of being much more difficult to treat, much more difficult to correct successfully so that we eliminate the deviation in all positions of gaze. That's very difficult to do with incomitant deviations. Paretic strabismus is one of the types, again, talking in very simple terms, is one of the two types of uh, strabismus that are incomitant deviations generally. Now, we do have this uh, physiologic change that takes place, which is called a spread of comitance, which I guess, if pressed, how quickly does this spread of comitance occur? I think my argument would be weeks to months uh, in uh, its existence from onset to where we are today. But paretic strabismus is generally a form of incomitant strabismus, which certainly can undergo the lengthening and shortening of sarcomeres within the anatomy of the EOMs, and undergo a spread of comitants and be less incomitant. The other form that produces grossly incomitant deviations under a simple heading would be mechanical restriction to the EOMs. Enough there as a preamble. Supranuclear strabismus. So the nuclei, the 12 pairs of nuclei, ranging from being having their origins be in the cerebrum, or to be in the brain itself, to those that are present and have their origin in the midbrain, the mesencephaly, to lower origins in the pons, and yet lower brainstem area being the medulla oblongata. But anything neurologically speaking, pathwise, the route that the initiation neurologically of an eye movement, because that's what we're talking about here, eye movement, eye muscle function, that occurs neurologically speaking above the level of the cranial nerve nuclei would be considered supranuclear. If a defect, a lesion, an infarct, which is cell death, if that occurs above, route-wise, above the nuclei, it's called supranuclear. If there's a defect, a lesion in the nucleus itself, it's called nuclear. If it's below the level of the nucleus, it's in the cranial nerve itself as it courses its way towards whatever its function is, to innervating whatever it innervates, it's called infranuclear. And yes, there's one more category, if that's not enough, which is called internuclear. And in moments, quite possibly, in moments, I will utter the words internuclear ophthalmoplegia, which implies that something's going on in tracts, TRACTS, tracts of tissue that extend between nuclei and are called internuclear disorders. Eye movements are the result of activity of discrete systems. Now, I read that somewhere and I stole it. We'll come back and talk about this discrete systems, but we've talked a little bit in the past about the 5 eye movement systems. We've talked about saccades and pursuit and position maintenance and all that sort of stuff. And eye movements, as this opening sentence states, are the result of activity in discrete systems, right? So your eyes are saccading or your eyes are pursuing, but these are discrete and, for the most part, separate systems. And saccades and smooth pursuit movements respond to target position and target velocity, respectively. And we talked about, the target position sort of thing and the immediacy of the brain wanting to see something causes this fast eye movement of hundreds of degrees per second in order to put the object of regard on the fovea. And we talked about pursuit being a very slow eye movement, and that if the target velocity, as I embellish this text, says, if the object of regard moves too fast for pursuit movements to maintain the object of regard on the fovea, then a cogwheel pursuit kind of response occurs. Compensatory responses to movements that alter the position of the eyes in space may depend upon the vestibular or the optokinetic systems, which are said to be non-optic kind of responses. They're more a response of the eyes and eye movement, respective of body position, orientation of the head, which has a great influence on the semicircular canals within the inner ear area, and compensatory eye movement responses depend very much on this vestibular cochlear input. Vergence movements allow fusion and binocular vision. And where would we be if we had no vergence movements? You talk about the patient with chronic progressive external ophthalmoplegia. We had this picture in our mind of the quadriplegic person, the paraplegic person who must exist in a world where they don't walk or labor very much so to walk because of some damage to the body, which prevents normal movement. And when we see someone with chronic progressive external ophthalmoplegia, we see what the ramifications can be for the eyes not being able to make vergence movements, which allow for gaining fusion and then maintaining fusion for binocular vision. Eye movement abnormalities of supranuclear origin may be divided into categories: nystagmus, other ocular oscillations. We talked about those during our nystagmus lecture, and that's basically what we call them. Were related ocular oscillations, not purely nystagmus, which is this somewhat non-abating, constant, ever-present rhythmic oscillation of the eyes. Eye movement abnormalities, I'll repeat that sentence, of supranuclear origin may be divided into nystagmus, other ocular oscillations, saccadic dysfunction, smooth pursuit dysfunction, gaze palsies, uh, tonic deviations, and vergence disabilities. Yeehaw! And it affects everything and just about every uh, type of ocular rotation that you might want to successfully and efficiently perform. Now, in the very first sentence, I said eye movements are the result of activity in discrete systems. Discrete systems mean, in terms of what we're discussing here, which is eye movement, uh, uh, that when indicates that when variables change. Okay, so discrete systems mean, in terms of eye movement, that when certain variables change, like the direction of the object of regard or the speed of the visual target or other input from various systems, the vestibulo-cochlear nerve, the vestibular nuclei, the uh, inner ear uh, input to the brain to indicate the the direction and or attitude of the body relative to vision and what we're looking at around us. Um, the needed eye movement or eye movements systems must respond. And uh, so the statement that eye movements are a result of activity in discrete systems uh, speaks to the influence of the five eye movement systems that we discussed before: saccades pursuit, uh, vestibular, vergence, and position maintenance. And these are complementary systems, because an object may move very quickly for a moment and then suddenly slow down from a rate which would be a saccadic degree per second movement to a pursuit degree per second movement. And the visual system is controlled by these discrete eye movement systems and uh, allow for efficient use of the eyes with regard to placement of the object of regard on the fovea of each eye and um, good visual function with uh, the added quality of life through the efficient use of eye movements. The first category within um, this discussion of paretic and supranuclear strabismus is, and as you will see, A, which is gaze palsy. So that's a very long section, and we're at 20 minutes already. I thought after you left yesterday that I could probably say something as I said before, a preamble to this whole long, complicated discussion of paretic and supranuclear strabismus. So I threw down a few thoughts, and there we go. So we're started. We're on our way. When we will next meet will all depend on how successful uh, my wife is at keeping me away from doing household projects tomorrow. You know what I mean? So, hey, I'm looking forward to seeing you today. Uh, I know you have plans with Emily to do some optics, optics is a fun topic. But we will um, um see some patients, learn some stuff, do some optics. Be careful on the way in. See you then. Peace.